Today I'm going to provide our latest updates on the COVID-19 public health response, including some of the updates around vaccination and vaccination issues, as well as the public health community response. As I don't need to say to people, we are heading into respiratory season, which means we need to ensure we have all of those pieces in place to put us in the best position possible to get through this next few months. This means ensuring we are all fully vaccinated, both for COVID and for influenza, and we make sure that we're taking the appropriate precautions as we all start to spend more time with loved ones and friends and family indoors. I also want to start today by acknowledging with thanks to all of the members of the legislature sitting again this week for setting the example of being vaccinated to safely return to work. And I am very grateful for all of you for working together and for supporting all of us across the province in making sure that that you are setting the example for people in British Columbia. To start with the vaccine update, today we are expanding the availability of a third dose to a second group of immunocompromised, clinically extremely vulnerable people. This is there's a number of people, as we know, who are in that group who were prioritized to receive vaccines early, and there are a number in that group whose immune systems do not respond as well to vaccines. And we now know that adding a third dose can actually stimulate a response for many people that gives them as much protection, or at least some protection, closer to what people with a strong immune response system have. So today we're expanding to approximately 100,000 people, individuals in British Columbia who will receive an invitation for their third dose. And these are people who are moderately to severely immunocompromised. So in addition to the groups that we talked about 15,000 people about 2 weeks ago, we are now adding people who are on active treatment for solid tumor or hematologic malignancy, so those are blood tumors, since March 2020, who have received or are receiving systemic therapy. So that includes chemotherapy, molecular therapy, immunotherapy, targeted therapies, including CAR T, monoclonal antibodies, hormonal therapy for cancer, and people who have both solid tumors as well as hematologic cancers, and people who since October 2020 have received or are receiving radiation therapy for cancer. So I know this is a broad group of people, and we have been working under the guidance of Dr. Ballum and Dr. Maureen O'Donnell at PHSA to make sure that we've been in contact with all of your specialists who have identified the people who are receiving these types of therapies, and you'll receive an invite from us in the next few days. In addition, people who have moderate to severe primary immunodeficiencies. These are diseases that we often develop or are born with. So these are combined immune deficiencies affecting T cell, immune dysregulation, particularly things like familial hematophagocitic lymphohistiocytosis. Those of you who have that know what that is. Or those with type 1 interferon defects caused by a number of genetic primary immunodeficiencies, etc. Again, we have been in touch with the specialists who most of you will be seeing to identify you. And in addition, people who have moderate to severe primary immunodeficiency, which has been diagnosed by an immunologist and requires ongoing immunoglobulin replacement therapy, so IVIG or SCIG, or the primary immunodeficiency has a confirmed genetic cause. And these are also more rare diseases like DiGeorge syndrome or Wiskott-Aldrich syndrome. In addition, people who have AIDS-defining illness or CD4 count less than 200 or CD fraction less than 15%, or detectable plasma viral load since January 2021, or HIV infection, and are people who are 65 years of age or older, or perinatally acquired HIV infection. Again, a small group of people that we are connecting to reach out to your care providers and to make sure that you have the opportunity to receive a third dose. There are also another number of biologic agents that can affect our immune system's ability to respond to vaccines. And these are often used to treat people who have autoimmune disorders. And we know there's a lot of confusion that I hear about people with certain autoimmune disorders, whether they can receive a vaccine or not. And to you, I say, absolutely. If you have multiple sclerosis, if you have rheumatoid arthritis, if you have lupus and many other illnesses for which some of these medications are prescribed, you are at higher risk of having severe illness or complications from COVID, and we have seen that across the board. So not only should you be immunized, you are now eligible as well to receive a third dose to make sure that you have a good, strong immune response. So there are a number of biologic agents, and I won't list them all. These will be available on the BC CDC website, on the Immunize BC website, so people can go and find out which ones they are. And in addition, we'll be adding people who since December 15th, 2020 have been treated with oral immune suppressing drugs. Again, drugs like azathioprine and others. And again, those will be listed. And people since December 15th who have been treated with immune suppressing infusions or injections of things like cyclophosphamide and others. Finally, another group of people who we know don't always mount a good, strong immune response are people who are on dialysis or have severe kidney or renal disease. And again, we have been in contact with your care providers around the province, and we have information on who you are, and you will also be receiving an invite to receive a third dose as part of your primary series. So you will be contacted by the provincial Get Vaccinated system about how and when to book your third dose. And if you believe you meet one of these criteria, and the details will be on the website, and have not been contacted by next week, you can get in touch with your healthcare provider, and we're providing through Doctors of BC and the college an attestation letter that will ensure that you can get your third dose if needed as well. As I shared a couple of weeks ago, people who are much greater at risk of severe illness, and in these two groups, may not have had sufficient immune response to 2 doses. This will bring these people up to the level that the majority of us who have 2 doses have. And so that is an important indication of a way to protect people who are most at risk for severe illness. I know that many people have been asking about third doses for people who are fully vaccinated, yet their vaccines or the combination of their vaccines are not recognized in some countries around the world. All of Canada's vaccines are highly effective in every combination that we have, and I presented data last week that showed that here in BC, and we have similar data from other provinces in British across the country. For those who have taken AstraZeneca, who've taken the vaccine that was offered to you at the first opportunity, you did the right thing. And I thank you for doing that. It has made a tremendous difference in transmission of virus and in protecting both yourself, your family, and your community. And your efforts have helped to reduce the spread of this virus in BC, and the data that we presented last week show that these combinations work and work well. We are now actively working with Health Canada and will continue to work with the Public Health Agency of Canada to make sure that Canada has a single internationally recognized vaccine passport that includes the recognition of these combinations. And I can tell you my colleagues at the Public Health Agency and Dr. Tam have been meeting with our counterparts in other countries, particularly the US CDC, and I know there's a lot of concern about travel to the US. Right now, there are no vaccine restrictions in traveling to the U.S. by air, and we know they will be updating the requirements in the coming weeks as we get closer to hopefully the land border opening. And we are working very closely with counterparts in the U.S. Centers for Disease Control to make sure that these highly effective combinations are recognized. So please be patient. I will also tell you that we've been working with colleagues in the UK, the European Union, and a number of the important sun destinations that many Canadians go to, including Mexico and the Caribbean, where mixed doses have been a part of the immunization program in many countries, in 19 of the EU countries, for example, and the UK. And these combinations are being recognized by many countries and will continue to do so as the data that we have here in Canada and in other countries shows how effective they are. So please be patient. This is changing rapidly, and we know that we will have updates on this in the coming weeks. I will also say that the WHO has been reviewing data on mixed and max combinations because it is important for the global pandemic response as well. And as part of that, I want to report that BC will be returning 300,000 doses of mostly Moderna vaccine to the federal government, to our procurer. These vaccines are not required at this time right now in BC, and we still have a large number of vaccines that are available to meet our needs over the next few months. And these vaccines will be part of the Canadian donation to the COVAX initiative. It is incredibly important for all of us in BC and in Canada that people around the world are vaccinated and protected against this virus. That is the only way that we will get out of this global pandemic, and it's important that we do our part to support that as well. We can be proud that we are doing that here in BC. In terms of our ongoing pandemic management, as I have indicated a number of weeks ago, we have an order coming out around requirements for vaccination for all workers in long-term care and assisted living, and I'd like to provide an update on that here today. That order comes into effect next Tuesday, October 13th, and the order in its details will be published on our website today. And there has been some modifications of it that are important. People hired between October 12th and 26th must have a single dose of vaccine and be at least 7 days post that dose and follow additional preventive measures, and must get their second dose within 28 to 35 days after that first dose. So people who receive their first dose prior to next Tuesday will be able to continue to work following these preventive measures, but they must commit and receive their second dose by 35 days after their first dose. This is recognizing that it is important for us to have people who are vaccinated working in these high-risk settings, and we encourage every single person in long-term care. We know the vaccination rates are high, but in some places they are not yet high enough. It is not too late to protect yourself, to protect your family, to protect those we care for, and the workers that we work with. People who are ineligible to work after October 12th because they have not yet received at least one dose will be off work as of that day without pay. If you do then decide to get your first dose, it will be 7 days before you're able to return to work with additional precautions in place. And you must again receive that second dose within 35 days after the first. Anybody hired after October 25th will need to be fully vaccinated to work in any long-term care or assisted living facility. In the orders you will see as well that we have made allowance only for medical exemptions. If you're waiting for a medical exemption decision, and it does take some time sometimes, we have a central process for doing that, then you must follow additional preventive measures as prescribed. So the forms that are required to request an official medical exemption are available on the website as well, and we have put out information to physicians and nurse practitioners around the province about what constitutes a valid medical exemption, and we've been working very closely with immunologists and allergists and our experts in vaccines at the BC Centre for Disease Control to make sure that we have all of the information that you need. So you must have a valid medical contraindication, and those are very few. The requirements, again, that outside healthcare outside healthcare providers, personal and other providers, must follow, which are in our vaccination status, are now in this order as well, which means that people who want to volunteer or work for personal settings, things like hairdressers or people who take care of podiatry, for example, in a long-term care home, you must be vaccinated to work in any long-term care home in the province. To support this requirement for vaccination for anyone working or volunteering in a healthcare setting, we are also updating our visitor policy for long-term care and all other healthcare settings. This supports and protects our healthcare workers and the people receiving care and living in these higher risk settings. Starting October 12th, visitors to long-term care and assisted living will need to show their vaccine card for proof of full immunization. And starting October 26th, in line with the orders around healthcare workers in acute care and community care settings, to visit in acute care settings, you must also show that you're fully vaccinated. Those who are not fully vaccinated will not be able to visit in healthcare settings as we go into this time of increased respiratory illness and challenges, as well as we know, COVID virus. We will, of course, have exceptions for certain situations like palliative and end-of-life care. This coming weekend is Thanksgiving, when many of us typically gather with family and friends over a meal. And I want to ask everyone, please keep your group small this year. Remember what we are seeing in our communities right now. And in particular, if you have older family members or anyone who is immune compromised is planning to attend, make sure everybody who is there is fully vaccinated. That's what you can do to protect yourself, then to protect those you are closest to. We want to make sure these gatherings are a happy occurrence and not a cause for virus transmission and illness in the coming weeks. We've learned that this virus, especially the strain that we're seeing causing illness here in BC right now and across Canada, the Delta strain, not only is way more transmissible, but it is causing more severe illness in younger people. And we see that every day in our ICUs here now, in our hospitals, in the number of people who have severe illness, and sadly, in the number of deaths that we're seeing. Vaccination protects you from this serious illness. We are seeing very good protection, continued very strong protection against severe illness from anybody who's been immunized. So it is not just altruistic, it's not just to protect our family and our friends, but it protects you. Even younger people who might have done quite well with if they had been infected with the virus that was circulating even a few months to a year ago. This strain is causing more severe illness, and our best tool to protect ourselves is to be vaccinated. I know in addition to our healthcare settings, many other organizations are also taking steps to put vaccine requirements in place for workers in their settings. It's about keeping your employees, your business partners, and your customers safe. And I would like to thank, as I did already, every member of the Legislative Assembly for committing to be fully vaccinated and doing your part. You are leading by example. And today, the BC Public Service has also announced a requirement for vaccination for everybody who's working in the BC Public Service. And I'm very proud of that recommendation as well, as we need to be showing the way and setting an example in our province here in the BC Public Service. I commend these efforts and encourage businesses to also consider this well-considered approach. Thank you very much, and I look forward to taking your questions.
Thank you very much, Dr. Henry, and I'm going to take you through just a few items of information today about the COVID-19 pandemic. There'll be a vaccine update, the proof of vaccine requirement in BC's public service, vaccination among long-term care and assisted living staff, contact tracing efforts, and ICU capacity and overall capacity in our hospitals, and our surgical renewal commitment. With respect to vaccinations, and this was as of Sunday night, more than 4,087,000 British Columbians have now received their first dose of a COVID-19 vaccine. That's 88.2% of eligible people 12 and over in BC, which is an achievement of the people of BC and of our extraordinary healthcare teams. 81.6% are fully vaccinated. You'll see that the gap between those who are partially vaccinated and fully vaccinated is closing. It's now 6.6%, meaning they've received 2 doses of a COVID-19 vaccine. Over 18 amongst adults, those numbers are 88.7% of eligible people 18 plus with their first dose, 82.3% their second dose. And everyone involved has decided to make themselves, their family, their community safer. Many employers have been seeking sound advice and guidance on vaccination policies applicable to their situation. These employer actions are welcome news to us all, and they are to be encouraged. As announced earlier today by the BC Public Service Agency, government is acting to increase workplace confidence across the BC Public Service and to stop the spread by requiring proof of vaccination. The BC Public Service is held to the highest example and is there to serve the people of BC. And this important step reflects that duty. It's of the utmost importance that all of us, government, business, and individuals, show leadership on vaccination to make sure everyone in British Columbia is safer from COVID-19. This step by the public service shows the dedication and commitment to support the provincial effort to protect people and get through the pandemic together. We strongly encourage everyone in the province who is not fully vaccinated to make the decision to do this today. Whether it's business or government, acting to make everyone in the province safer from COVID-19 is the right step for everybody. To those who are eligible to be vaccinated, but who have not made the decision to do so, I say this. What matters in our BC pandemic today is what we do right now. What matters, it's not what we did a year ago. It's not what we've done over the last 6 months. It's right now, this moment. And what matters right now is that each of us makes it through, that we make it through safely, that we make it through healthy, that we make it through, that you make it through. And offering yourself unprotected to COVID-19, presenting yourself unvaccinated to the brutally and assuredly transmissible Delta variant when there's an alternative is no way to make it through. There will be many legacies arising from our BC pandemic. Some, as we've seen, are positive, restorative, and affirmative. Let not be your legacy be one of, I should have, I wish I had, if only I had. That is no legacy, not for you, not for your family, not for your friends. Please make the better decision. To those who are eligible to be vaccinated and have not decided to make this essential life and health-saving decision, I implore you to look around you, to see the loss and the regrets that others who thought they could face COVID-19 unvaccinated have expressed for trying to face this foe unarmed, unsupported, and so needlessly vulnerable, and make a better decision. Choose your health, choose your loved ones, choose safety, and get vaccinated. With respect to the vaccination of staff in long-term care facilities, I wanted to bring you up to date on where we are. Dr. Henry talked about the order that will be published today. With respect to this, we know that this order is coming into effect end of day, October the 12th. That's next Tuesday. And I want to give you a sense of the numbers of who's vaccinated and what percentage people are vaccinated in different health authorities. Every health, long-term care and assisted living facilities has or will be putting a plan in place to address the potential health human resources challenges involved. We have some facilities that have not provided the information yet, but they are doing so in many cases today and have done as we speak, and we'll have full information to provide you shortly. In the Fraser Health Authority, 97% of healthcare workers in long-term care and assisted living have received a first dose, and 93% have received a second. In the Interior Health Authority, 93% have received a first dose, 88% received a second. In Vancouver Coastal Health, 97% have received a first dose, and 94% have received a second. On Vancouver Island, 95% have received a first dose, and 91% have received a second. And in Northern Health, 88% have received a first dose, and 79% have received a second. That's for long-term care. For assisted living, in Fraser, it's 96% first dose, 94% second. In Interior, 95% first dose, 90% second. In Vancouver Coastal, 99% have received a first dose and 96% a second. In Vancouver Island, 97% have received a first dose, 94% a second. And in Northern Health, 93% have received a first dose and 87% have received a second. We'll be sharing more data on this later this week when the data is finalized, but that tells you where we are. Those percentages represent about 46,000 healthcare workers. And I want to note to everybody, and Dr. Henry has been clear about this, that this group of people, the group of people we're talking about, has done extraordinary work in this pandemic. Their generosity, their commitment, their dedication is something that we are all honored and proud of. And this is another step in that journey. It's a provincial health order to get vaccinated. And so if there are people who are currently unvaccinated, at the end of day, on October 12th, they will be going on leave of absence without pay. And as Dr. Henry has said, there will only be medical exemptions from that. And so now is the time to get vaccinated, to not have that happen, but as well to support the efforts that are so important in long-term care to ensure that everyone is protected. I'm so proud of our workers in long-term care. I'm very proud of these levels of vaccination, which shows the commitment of people in long-term care to the safety of residents and the safety of the community. And we have the opportunity in the coming days to do even better. And I encourage everybody to do so. As I reported last week, as COVID-19 cases declined over the summer, we went at the height of the second wave to more than 10,000 active cases. We went down to under 1,000 for a period, and now we're back at around 6,000 cases. Health authorities redeployed some contact tracers to support vaccination or other public health efforts, while others returned to their base positions, including acute care and others other areas that needed support in the healthcare system. In the weeks since, health authorities have refined their initial data on individuals who have returned to contact tracing positions and have added additional staff, bringing to 1,396 the number of contact tracers in place across the 5 regional health authorities and the Provincial Health Services Authority as of October the 4th. That's 504 in Fraser Health, 195 in Interior Health, 152 in Northern Health, 188 in Vancouver Coastal Health, 119 in Vancouver Island Health, and 238 in the Provincial Health Services Authority. Each of these health authorities continues to add additional contact tracers, and I will continue to report on that progress in the coming weeks. I want to briefly speak to issues around ICU and hospital capacity today. As you're aware from previous briefings, we have 9,218 base beds in our healthcare system, and a further 2,353 surge beds across the healthcare system. And today, base bed occupancy rate is 94.3%. Surge bed occupancy rate is 15.3%. So to put that in context, in terms of our overall health system capacity, as of today, 9,052 people are in hospital overall in BC. That number on September 3rd, a month ago, was 9,088. So it seems like a calm and stable situation in the sense that it's a similar number. It's slightly declined in overall hospitalizations. But this is because of the measures that we've had to take together to support one another in this pandemic. The decision I'll be reporting on later to delay certain surgeries, for example. So the situation is being managed, but it is not in a good way when you have to make the kinds of decisions we've had to make. As you'll know, as I reported yesterday, 32 people in ICU in the Northern Health Authority have been transferred to the Vancouver Island Health Authority, Fraser Health, or Vancouver Coastal Health. 26 of them are COVID patients in critical care, and none of those 26 is fully vaccinated. That's the reality of the situation. And so all of these steps are being taken to ensure that our acute care system can respond appropriately to all of the things it needs to respond to. That's the overall question. In critical care, as you know, There's 510 base critical care beds in our province, which is a significant number of beds. Of course, there are 218 surge beds for a total of 728 critical care beds in our province. And just to put that in context, today we have approximately 467 people in total. That's not with COVID-19, in total in critical care. And that is a significant number, and it's not too dissimilar to the number that were in critical care on September 3rd, which is 446. But, of course, a very significant number of those, and we'll be announcing them later, are in critical care with COVID-19, and 120 of those are unvaccinated in critical care with COVID-19, a position and a situation of high risk. It is obviously not desirable to be deferring surgeries and other procedures in our healthcare system to deal with the situation. And the message in these numbers, which have been consistent, is that we will continue using the plans that we've made public and in September 2020 to continue to manage our healthcare system to ensure care can be provided for everybody. But the one thing we can all do, the one thing we can do to help in our healthcare system is to get vaccinated, and to get vaccinated today. Last week I reported that pressures from COVID-19 had caused additional postponement of non-urgent scheduled surgeries in several health authorities. And a number of hospitals continue to postpone surgeries. That means from September 26th to October 2nd, the health authorities postponed 241 non-urgent scheduled surgeries. That was 16 in Fraser Health, 56 in Interior Health, 1 in Northern Health, 11 in Vancouver Coastal Health, and 157 in Vancouver Island Health. From September 5th to October 2nd, cumulatively, there have been 1,384 surgical postponements. That said, surgeries are continuing. You'll see the dramatic difference in these numbers compared to the suspension of non-urgent scheduled surgeries in the first wave of the pandemic. So from September 12th to September 18th, health authorities completed, with all of this going on, 6,530 surgeries, which is, I think, an extraordinary effort by everyone in the health system. Last week, I reiterated our commitment to every patient who have had their surgeries delayed, that they will soon receive a phone call to reschedule their surgeries. Every one of these surgeries is important, and we all need to do our part. Just to report on some of the details, in Interior Health, Royal Inland Hospital will resume non-urgent scheduled surgeries this week, meaning that Royal Inland, Kelowna General, Penticton Regional, and Vernon Jubilee hospitals are resuming non-urgent surgeries. In Fraser Health, also this week, Surrey Memorial Hospital will resume non-urgent surgeries in a second operating room, fully restoring all surgeries at that hospital. As we've said throughout the pandemic, the people we're relying on to deliver surgeries are in equal and greater measure counting on us, on all of us, to stop the spread so they can do their critical work. And so I wanted to say finally, my continuing appreciation to everybody working in our public healthcare system and to everyone in BC. We are making progress, and we need to keep building on the momentum of vaccination in our province. The community that's seen the largest increase in the last month, in the month of September, was Fort St. John, the largest percentage increase in its vaccination rate. And I applaud those efforts, and obviously at 72% we want them to continue. But those have been significant efforts. We are making progress, and we can continue to do so. But it is important, it is critical, it is essential to get vaccinated now. And I encourage everyone in British Columbia, again, to do so. And with that, we're happy to take your questions.